Nature's wealth, good for your health. This is the Raw Life Health Show.
Alright everybody, it's Paul Nison with the Raw Life Health Show, and here I am in Dr. Schindell's office. I'm really excited. I just got my blood work checked, and I was here 8 months ago, and I saved a video of that, but I didn't post it because I wanted to come back and see how I was doing now and talk a little about the changes I've been making in my diet and my supplement routine, and see how it changed on my test. And overall, the results were on the positive side.
I have in front of me Paul Nison's current clinical laboratory results. The tests were follow-up on his longevity profile back a few months ago. We have repeated the abnormals mostly, and we are expecting and seeing some good improvements here, it seems. We have repeated the DHEA, dihydroepiandrosterone sulfate test, on him, and his result was, is that okay for me to discuss this?
Definitely.
Okay, so he's proving and giving me the permission to put this on record. His DHEA this time was 228, which is that of about a 65 to 70-year-old man's DHEA. What he had before was a little bit higher, 324. When he started out was 154. So it definitely has improved quite a bit, but there is more to go. IGF-1 is insulin-like growth factor, also called somatomedin C. This is the actual true growth hormone. It's important for muscle strength, for bone health and strength, for youth and vigor. Your level was that of a 50-year-old man on the low scale. Looking at the IGF-1, insulin-like growth factor, well, you're not doing much good on it because you're really not even doing much about it, if anything. We did it once back in February. It was 92 and now it's 66. Well, you know, this hormone, like all others, have a tendency to decrease with age, and vigorous exercise can help to increase it. Some think that some amino acids can help to increase it, like arginine, for instance, arginine and lysine. Okay. You must have a very stressful, physiologically stressful life. What's even more significant is your parathyroid hormone. I'm glad we did the whole thing. Is very high. I think you had that situation before with PTH. That means that you are losing bone. Okay. Yeah, you were normal here in March of 2006, and you were just normal here in December 2008, but now you're way.
So it's too high?
Yeah, it should be, as you can read that, it should be less than 59. If you are in the 50s, that's already possibly losing calcium and bone. Okay. So you are developing osteoporosis. That's what it is.
Okay.
That's your PTH. Your PTH last time was 49, which was sort of borderline. Before that it was 51, before it was 80. So it's good now. 42. So it's a good thing you asked, because that's also a big improvement. You know, if you don't know about these things, you will never do anything about it. Because you may be feeling well, you may be feeling tired, and you will blame it on your busy lifestyle. You know, you're always here, there, somewhere, teaching, preaching, learning, doing all those things. And you can totally neglect your physical, bodily needs by not knowing what's going on. Your C-reactive protein is fine. That's an inflammatory protein, and that's a very sensitive marker for coronary heart disease and development of, and also cancer marker. Many doctors look at this as a tumor marker. Yours is very good. You don't have any problem with that. Your homocysteine is high. Apparently you're not doing enough to get get rid of it. Let me see what's the story on that. Homo. Okay, it should be less than 7. Well, you were good here in July of 2008. You started out with 2 units higher, then about the same, then you spiked up all the way to 12, then you came down to about normal, and now you're crawling up again. You know, you have to take B12, folic acid, and B6 for that to reduce it, and sometimes also TMG, trimethylglycine. I think you took this for a while. I don't know if you're taking them now or not. Your homocysteine is dropping very nicely. You're just about normal now. Last time it was 8.7, it should be less than 7. So now you have 7.7. That's a whole full unit that came down, and this is one of the very serious coronary risk factors. So I'm very happy to see this. You start out with 9.1, 9.7, then you jumped up to 12 in 2007, and then you went down to 7.3 in July 2008, then you went up again in December last year, and now you have 7.7, so that's comfortable. Other than that, your good cholesterol is normal, but it's on the low side. See, it should be greater than 40, which you are greater than 40. So that's really a very low concern here. Very low density lipoprotein VLDL is high. This is another cholesterol. LDL, which is the bad cholesterol, it came down beautifully. It was 178 last time, and now it's 116. This is really a very major drop in the bad cholesterol, which is the one that will cause, again, coronary heart disease and could cause eventually heart attack or a stroke. So I can only attribute this to the fact that you are taking, and seriously, you're taking some of the supplements. There's no other way to deal with these things. No
what
matter,
about the change in diet that I've made?
Well, that you have removed some iatrogenic factors.
Well, I actually didn't remove, I added animal products, which before I wasn't doing. So I really didn't remove as much as now I added milk and eggs on a regular basis.
Well, there are some studies showing that milk actually contributes to removing bad cholesterol from the bloodstream. So, all in all, what you're doing is only having a good, reasonable and beneficial effect. So I'm really glad that you did the whole thing, because now you have a comprehensive picture.
All right, we just went over my blood work. Tell them how it was, Doc.
Looks like you need a little more work. Generally, you did very well. Life goes on, and we have to guard our health every day, and you know that. So whatever needs to be corrected, those minor things, you can very well do. Just keep your mind on it. And we'll probably retest you in a length of time, maybe 6 months or so, and see how successful you are to collect the few deficiencies, or this, I guess, not totally normal results. So you really, stepwise, we see that there is a progress which you would have never made, really would have never made, if you don't know where you need to make corrections.
Sure. I still have things to work on, but this is the thing. The basic blood test when you go to your doctor's office, I mean, it's good to show you if you're seriously deficient in something, but if you get a great report, it doesn't really mean much, because there's so many factors that can determine that and determine your blood work overall. So that really doesn't mean much. There has to be more. And the test that Dr. Shandell gives, the longevity blood profile and the cancer profile, these are the things that can pinpoint what is actually going on. And so what I do, and I'm just an example, is he treats us each on an individual basis. So I find out that what I've been low in, and I've been coming here for years now, and then he talks to me about that. He recommends some supplementation and some diet suggestions, and he's kind enough to give me a personal consultation along with his regular lab work. But I recommend it. You know, he can do that as well for you, but it's a separate service that he offers is a consultation fee is also not just the results of the lab work, but I definitely recommend you get them both as maybe a package deal. You can ask him, but it's definitely worth it. So basically, I'll go through everything from last time to this time, but basically everything's my DHEA improved on the amount of that. I don't even know what some things were until I met Dr. Shindell, like my IGF-1, and most of you haven't heard about that. So that shows that I need to take certain supplements, and Dr. Shindell told me what supplements I need to take to get that better. And but my testosterone, we've been looking at that, and that shows a slight improvement, so it's moving in the right direction. My cortisol, this was an issue. This is one of the only things that's going in the wrong direction, and that has a lot to do with stress. So it's not only diet; it's a lot to do with stress. But my cortisol is something I definitely have to look more closely at. My PTH, which determines the calcium that's being leached from the bones, I definitely showed a tremendous improvement from that when I first came to see Dr. Shindell. I think it was in the 60s, maybe even the 70s. Which the range should be on the low side 13, but on the high side 59. But now it's 42, so it went from in the 70s to 42. So I was having a serious issue with this, and that was on a raw vegan diet. And now it's much improved. My homocysteine dropped a whole point, and the homocysteine is a factor for coronary artery disease, and so that dropped a whole point. Where I'm average now, towards the high end, but still in a safe zone. Where when I first came to him, I was in on a raw vegan diet. It was too high. So some of you out there might have a good B12 level, but if your homocysteine is too high, that can still be a big factor for heart disease. So another example of the things that the average doctor won't look for, but it's important to know. The greatest improvement we have seen this time is my LDL. That's the bad cholesterol, which was way off the charts last time on a raw vegan diet, and now I added animal products to my diet, and it actually came down to where it's in a good range. So that was nice to see. And my iron is another thing I have to look at. It's still, Dr. Shindell told me to take an Ironman supplement last time, and that's the only one I've been lacking in. I started taking it, but I stopped taking it. So that's the one I've been lacking in, and it showed. It didn't really move from last time. It was a little low last time, and it's still a little low now. But overall, I improved on just about everything, and I'm going in the right direction. It's not perfect, but it's going in the right direction, and it gave me a couple of suggestions here of what I should do to improve this, and I'll do this, and I'll come back here in 6 to 8 months on the long range, maybe in another year. But I'll get tested again, and the test isn't cheap, but it's worth it once a year. And again, you contact Dr. Shindell. You don't have to get the test, because he's in Florida. If you're somewhere else, you can get the blood drawn. He could set it up with you where you can get the blood drawn in a local laboratory and sent to him. His website is Dr. Shindell. Give everybody your website again, if
okay. American Metabolic Laboratories.net. That's all one word. That's the name of our laboratory, American Metabolic Laboratories.net.
His phone number is 954-929-4895. But I definitely recommend you get his blood work and also his other services, because he has another service of his consultation also, which is another fee, but well worth it in my mind. So everybody, this is Paul Nison with the Raw Life Health Show. Thank you for watching, and have a great day and a great Raw Life.
This is the Raw Life Health Show. Raw Life, bright and